Welcome to the Therapist Connect podcast. Dr. Peter Blundell interviews therapists about their work and experiences within the therapist community.
Hello, and welcome to the Therapist Connect podcast. My name is Dr. Peter Blundell, and today I'm interviewing counsellor and psychotherapist Ciaran Hurley. Ciaran is a therapist in Sheffield, but he also has a background in nursing and has been a lecturer at both of the universities in Sheffield. And I welcome him to this episode of the podcast.
Hi.
Hello.
How are you doing?
I'm really good, thank you. How are you?
I'm okay, thanks. Yeah, I'm well.
Good. Good.
Sorry
Thanks very much for doing this.
Well, it's a pleasure.
So I suppose my first one is then, how did you come to be a therapist and kind of what drew you into doing therapy?
So I started at 18, I went to be a nurse.
Mm-hmm.
So I went to university, trained in nursing, worked in operating theatres and critical care kind of environments for 11 years.
Wow.
Towards the end of that, my career was heading into an education kind of field.
Yeah.
I had a few different roles, kind of supporting colleagues in their CPD and further training. That led to some guest lecturing at university,
mm-hmm.
which then led on to a career in lecturing. So I spent 15 years altogether in two different universities.
Wow.
Then during my university stages, various precipitating factors, I had a few episodes of depression for which I saw types, so I got some counselling for that. Mm-hmm. And I had a vague awareness of counselling as a thing that people used, and never really kind of had any understanding of what it was or how it worked. So experiencing it from the kind of client perspective was a real eye-opener. Mm-hmm. And what I learned through that, amongst many other things, was that counselling was as much about learning and development as it was about health and well-being.
Yeah.
Which it made a lot of sense to me. So once I kind of felt like I was properly done with the depression, as much as you could ever be, it's always there in the background, isn't it? Once you've had it, I think. So once I felt like I was pretty much safe from relapsing too readily, I set off on a counselling training course, kind of signed up, did a foundation year to check it was what I really wanted, and then committed to the full 3-year diploma, part-time.
Never looked back.
and never looked back. Well, during that 3-year diploma, my identity just completely shifted from lecturer to therapist. And I just thought, all the frustrations of working in higher education, I'm not really getting much benefit to offset the frustrations. Mm-hmm. So by the time I got to the end of my diploma, I'd already decided that I was going to just quit working at uni and dive into private practice and, apply for jobs and do whatever it took to support myself on that.
Fantastic. I find that really fascinating because I trained as a social worker. Sorry, I trained as a therapist, then I trained as a social worker, and now I'm lecturing about social work and therapy. So I find it really interesting, people who've gone from different careers really, and that whole idea of our professional identity changing as we moved between the different roles. But it's interesting, you've done similar, but you've kind of come to therapy at the end of the journey, really.
Yeah.
Do you miss either nursing or lecturing at all?
I don't. That identity shift that I talked about then, it was familiar to me already, in a different flavour.
Yeah.
I'd felt it from being a nurse to lecturer. So in one university, I did have a clinical role as well as the lecturing role. Mm-hmm. So I kind of worked in a clinical environment as well as being a lecturer.
Yeah.
But in the other university, there was no capacity for that, and it just wasn't an option. And the further away I got from that clinical experience, the less and less like I felt like a nurse.
Yeah.
And whilst I was still on the register, because it's a requirement for the job and all that, my practice was very much around the research and education of nurses, not the doing of nursing.
Yeah.
And that's what, again, that's another theme that kind of, it was part of learning to be a lecturer. It was also part of learning to be a therapist. It was also something I experienced as being a lecturer, was that I am a nurse, but I do lecturing. And that difference between being and doing was really quite a powerful awareness for me. And it, when that old adage that those who can't do teach.
Yeah.
Yeah. Having that conversation around, well, actually teaching is something you do, but nursing is something I am. It really kind of put a nice frame on that type of conversation. It comes up every now and then. So, yeah.
It's fantastic. I found the transition into lecturing really interesting, and I think because it's about something that I love and therapy, I really enjoy it. But seeing the kind of students develop and get from kind of starting out on their training to kind of being qualified therapists at the end, I think is fantastic, really. But I think it's helped with my own learning about therapy, actually seeing so many people go through that journey, whilst I'm kind of on the sidelines, if you like, kind of watching them change and get their own professional identity.
Have you been a lecturer for long?
So I've been doing it for about 2 years now, right. So still kind of, I'd still probably say quite new, really, to be honest with you.
Yeah, well, as you can imagine, in 15 years, I saw quite a lot of groups kind of start, go through it and then graduate. And I agree, it was a really nice experience to kind of see people go through that journey from beginning to end. And, yeah.
It's brilliant. Fantastic. So how would you describe your therapeutic approach then, your modality, if you like?
Well, I describe it as existential. Mm-hmm. And I got, not told off, but there were conversations had between me and lecturers at the place I trained.
Okay.
The diploma, my certificate says that I'm an integrative therapist.
Yeah.
And I'm really quite convinced by the work that Mick Goop has been doing recently around pluralism.
Yeah.
And Mick specifically coming from that existentialist basis.
Yeah.
And the thing about the existential approach is that it doesn't preclude or it welcomes any technique that's applicable. So, I do describe my approach as existential, because what I'm dealing with is the client's experience at the time they're experiencing it and the impact it's having on them now. And obviously the only thing that they can tell me and show me is what's happening to them right now in this moment. So, and for me, the philosophy of existentialism that kind of underpins the existential approach to therapy, it all makes so much sense in that perspective of, we have nothing but this moment.
That's really interesting. Have you always described yourself in that way in terms of from your training, or is it something that's changed over time, do you think?
I always have, I think, because there was a period in training when I'd say, I was doing an integrative diploma, and that's what I was doing. And in those first couple of years, like the foundation stage, and then the first year and early second year, I was kind of like a bit unsure, kind of still finding my feet, still getting to know what the theories were and what they meant. And it was when I started reading about existentialism that so many things just fell into place. That I thought, do you know what? Integrative doesn't describe intensely enough how I feel about existential approach. So, so it was a growing awareness. That kind of coalesced into something very real for me.
Yeah.
Toward the end of my second year of training.
Fantastic. And you mentioned there about pluralistic practice. So do you consider yourself existential and pluralistic, or do you just appreciate it from the point of view that Mick obviously has come from an existential background, if you like?
Yeah, I think the pluralism, to my mind, existentialist approach, because it is so focused on the moment. Like not even the session, the moment in the session.
Yeah.
And responding to the experience of the client. Now, I've read about loads of little tips and techniques and methods that people can use to learn and understand themselves better, to quiet the inner voices that are, horribly self-critical or destructive or disruptive. That I can tell people about those methods, and I can give them papers that describe it to them so they can refer to it later, or little self-help tips. But none of that replaces the presence of me in that, and my response to what the person tells me or what I observe in them as they're sitting there.
Yeah.
So I think the pluralism is the bit that admits any and every technique that is feasible and possible and useful.
Yeah.
And that I feel is within my scope, and that's where CPD is really important.
Yeah.
Developing and enhancing those, the skills, the techniques, the methods.
Yeah.
None of it will ever replace, or
the core. Yeah.
Or supersede. Absolutely. Yeah. That existential presence of I'm going to be authentic and honest with you. That's going to be balanced with being respectful of your needs and your resilience and where we're at in the journey.
Yeah. And I think it's fascinating as well, in fact, these discussions about our approach and how we define it and what it actually means to us. And speaking to lots of different therapists, everyone's really passionate about how they see therapy and what it means.
You'll be familiar with Erin Stevens.
Yeah.
I've got a huge amount of respect and value for the voice that Erin's putting out there.
Absolutely, yeah.
She's calling everyone to be just accepting and understanding that we are individual and each what we are.
Absolutely.
We form a profession that has so many talents and so many opportunities to engage with clients in ways that are absolutely beneficial and.
Absolutely, and it's kind of bringing everybody together, isn't it? And kind of acknowledging that there's differences there, but actually we're probably stronger together than we would be kind of apart, really. And we've got enough difficulties as it is without infighting amongst ourselves.
Absolutely.
Do you describe yourself as having any specialisms then in terms of your practice and the type of work that you do?
I only qualified in September 2019.
Okay.
So it only be in April 2020. Kind of 6 or 8 months in. I feel it's a little early to declare a specialism.
Yeah.
But I'm keen to work with children and young people.
Mm-hmm.
So I've had before schools were closed, I had a job in primary school, working with the older end of primary school children. I did 4 sessions a week in high school. Again, working with the older end of the children in high school. And that was a high school with 6th form, so I've worked with a couple of kind of 17, 18-year-old children as well.
Yeah.
It feels strange calling them children at that age because they're so they're so ready to be adults. It was great to work with them. And that's been, I've loved working with the children and young people. Being a university lecturer, I'm also quite keen to kind of draw on that skill set of working with young adults who are just making their way in the world, still in the formative stages of life.
Yeah.
Where, if they're experiencing difficulty and they get some help in kind of the growth and development that helps them to overcome and be resilient to life's challenges. What an opportunity to kind of really help someone to get the baseline right so that through their adult life, they've got the skills and the self-awareness to kind of grow and mold themselves in ways that they want to be.
Absolutely. And I think as well, having, a counsellor at that kind of age in your life, really, where you can explore stuff and kind of actually really talk about what's going on. I think if you don't have that, actually, you can build lots of problems later on. And if people haven't got that opportunity to talk about things and kind of process stuff at that, as you say, at that kind of key age, really, when you're trying to figure out who you are and what you're about. Yeah. What kind of thinking about that angle then as well,
what kind of advice, because if you just kind of qualified within the last 6 months, say, if someone's thinking about training to be a therapist at this moment in time, would you give them any advice before going into it? Now it's probably still really fresh in your mind.
It is, yeah, and it's really hard to kind of give generic advice because for me, the process was so personal and so introspective that what I learned in it was completely different from what the 10 other people in my class learned.
Yeah.
But what we did do was, and I will be eternally grateful to my colleagues in this, was we were really respectful of the fact that we were each on our own journey, but we were doing it together in parallel. And it was a really kind of supportive and nurturing group to be in, but without any of the there was no expectation that we would be, do the same in any way, really.
Yeah.
So I think, if any, I would say that's the thing to be ready for, is that yes, you're going to learn some theories and some ideas and some skill, but really, be ready to learn about yourself and to challenge yourself and allow yourself to change.
I think that's that idea there of what you're talking about of like your own process, but then a group process as well, and the balancing all of that and kind of understanding, as you say, that everyone's going on their own journey, but you're all going on a collective one as well at the same time. So it's hard to describe, isn't it, before you've been through it yourself, to kind of explain to people what that entails and what that's about.
Yeah, it is. But then on the placement side, on the skill side of things, I would also say to be courageous, because it's easy to avoid, the complex cases or the risky cases because you don't feel ready yet.
Yeah.
But if you spend the whole of your training kind of not feeling ready, there's a massive risk then that what you become at the end of it is someone who's not ready. And that someone, at some stage in the training, you have to grasp the nettle and trust your supervision and trust your college to support you with what you need to support the client through their own development and growth.
Has there been any challenges then since you've qualified and since you've been working as a therapist? Because it sounds like you've been quite successful. You've got a couple of organisations and your own private practice, so that sounds good. A good start.
So I'm a natural schmoozer. I'm a real people person. So I never leave the house without some business cards.
Good top tip for people setting up in private practice.
Yeah. Everyone I meet that doesn't know already gets a business card. Following up on every kind of inquiry and anyone showing the mildest bit of interest, then I've kind of told them about my practice and my work. When the primary school contacted me to say, would you be interested in seeing a few of our children? I was kind of like, yeah. And it was just that kind of, that query came out of the blue, really, to me. I didn't really, that was a friend of a friend who passed the card on to a teacher at the end. I was I was a little bit kind of surprised at first, but then thought, do you know what? I know what my limits are. So before I actually commit to seeing meeting the client group, I'm going to have a chat with the people in the organisation to say, what do you need?
Yeah. What
am I offering? What are the safety nets that we need to put in place? And that was really useful to just kind of to get in there. And then whenever I've been involved with another organisation, I've kind of just made it clear, made it known that I'm looking for work. That I've got hours available. If they've got work available, then let's talk and negotiate.
Just that idea of putting yourself out there, really, and kind of, as you say, making people known. I suppose networking, if you like, and kind of making sure that people are like, well, look, I'm here if you need me. And it's obviously led to a variety of opportunities for you as well.
It has, yeah. And I've had to be really flexible in that because I went to a couple of networking events, and then when I followed up on it, like one person, personal circumstances had intervened, and they'd said, "Oh, give me 6 months and get back to me." Well, obviously, my next point of call was to put a little reminder in my diary in 6 months' time to get back in touch with them.
Yeah.
Which is, that door's not closed necessarily, but we don't know what the future holds. So it's that sense of, being flexible, being responsive to every inquiry you get, and
making the most of those opportunities. Yeah, absolutely. Don't let them pass you by.
Yeah, and that there's got to be a balance of kind of believing in yourself.
Yeah,
you have the skills you have the training you've got, but also knowing your limitations. There's got to be time when you say no to some work, either because you've reached capacity, or that's out of your league, or that's a client group that you're not comfortable with, or whatever the reasons are for saying no. That's another option. You don't have to say yes.
That reflective process, of understanding what you can and what you can't do. Yeah. So you were one of the first people who kind of responded to the Therapists Connect stuff. So I was just wondering, how you'd experienced it, and two, kind of how do you experience social media as a therapist in general? What's it been like for you?
Well, I've been a bit averse to social media in the past, and I kind of feel a bit novice with it. And especially using it as a business person, it's kind of like the adjustment's quite strange. It feels like an uncomfortable suit sometimes.
Yeah.
So I've heard stories about Twitter being, it can be a bit of a rough place to.
It certainly can.
And I've seen a bit of that.
Yeah.
But generally speaking, I think because I'm coming into it looking for other therapists and people involved in education, especially primary education, these are quite gentle people that I'm kind of coming up against. So my experience largely has been quite good. The politics of the last few weeks has brought a different flavour to my feed.
Yeah.
I feel the politics quite a lot.
Yeah.
I think my personal perception is you can't separate politics from life, because every aspect of our life has a political dimension to it.
Absolutely.
So that element of it in the last few weeks has been quite challenging, quite interesting, quite difficult at times.
And do you find yourself being an observer, or are you engaging with that debate?
I try and hold back, but sometimes I do. I get drawn into stuff. It's just tricky.
It's tough, and I was very similar to you. I was on kind of personal social media, but I hadn't really used Twitter before until I started lecturing, and I thought, okay, well, maybe I could engage with some people around education, as you say, and kind of therapy. And overall, I think it's been generally positive, but as you've seen yourself, kind of can get into situations where you think, oh gosh, how did I end up here? Kind of, it's not where I wanted to go. Or, as you say, observing things from the outside as well. But I think generally I've found therapists to be quite supportive of each other, really, and that's what you'd hope,
Yeah, absolutely. I mean, the Therapists Connect hashtag has that's brought to my feed a lot of stuff that I've found really valuable, really useful.
Fantastic.
I picked up a couple of CPD stuff through it, CPD events, and it's some of the conversations on an everyday basis have been really nice. And it is as a private practitioner, there is the potential to become quite isolated. To kind of not be making regular contact with other practitioners. And I think, although it's quite a light touch on Twitter, because you've only got the 280 characters, just knowing that there is a body of people out there who have kind of, they've exposed a bit of themselves, you've got a flavour of who they are and how they approach life and therapy and the world. There's a baseline there that I'm aware that if I needed to make contact with some people, I have some names in my head of people who I might drop a message to say, any advice on this, or I'm struggling with this, or something like that.
And I would probably say that they would all respond as well to help you out, because what I've found particularly is that lots of these people are there because they do want to connect and they do want to support each other, and I think you're right. I think being in private practice particularly can be quite lonely and isolating, whether you're kind of newly qualified or you've been doing it for kind of 20 years or whatever. We don't get that many opportunities to mix with other therapists, I don't think. But it's been great chatting to you, and I wish you the best of luck with your private practice in these difficult times. Sounds like you've got it covered, though. So,
yeah, I mean, you got to roll with the changes, haven't you?
Yeah. Thanks very much. Thank you very much. Okay. Cheers. Thanks, Ciaran. All right.
Thanks again. Take care. Bye-bye.
Take care. Bye now.
Thank you for listening to the Therapist Connect podcast. Go to www.therapist-connect.com for more discussions and debates.